Doctors at one local hospital are seeing a number of patients with questions about the COVID vaccine, especially pregnant women.
Yeah, and no one understands more than our soon-to-be mommy, Dina Kupfer. She's got more details.
Yes, good morning. So being pregnant in a pandemic has been a challenge, and I know for a lot of moms out there, wondering if you're making the right decision for your body can be challenging, especially because you have another body to think about. So to help clarify all of our questions, we have a very important person here. We've got a doctor, Dr. Veronique Taché, who is the maternal fetal medicine physician for UC Davis Medical Center here in Sacramento. So first of all, thank you for your time. I know you're very busy. Let's talk about COVID numbers in pregnant women. I keep seeing startling articles that women who are pregnant and who come down with this infection, it can be deadly not only for them, but also their baby. Is that right?
Correct. We're seeing higher rates of women who are unvaccinated getting very ill from the infection. And our concern with that is it impacts not only the mom, but as the baby as well. And so some of our decisions are driven to help the mother and the baby, and what happens to mom obviously will happen to baby, especially if we have to deliver them early or premature.
Okay, so I solicited questions from people on Facebook and on Instagram, and some people want to know, is the vaccine safe for the mom and the baby? What is your answer?
Yes, absolutely. So the vaccine can be given in any trimester. It can be given while you're trying to conceive or while you're breastfeeding. As of now, there's no specific trimester that it's best to give in. I think that's still yet to come. And for the baby, it is as well. And in fact, what they've shown is at the time of delivery, the mother's antibodies, so that's what the mother creates in response to the vaccine, comes through the umbilical cord, through the umbilical plug to the baby, conferring some form of protection for the baby at birth.
And does that happen if you get the shot, if you're 6 weeks pregnant versus 34 weeks pregnant? Is there a difference in the antibodies?
Yeah, that's a great question. And they're still trying to figure out what the optimal time is to offer the vaccine to try and get the highest amount of antibodies in the baby. As of yet, we don't have that information.
Okay, another question that I got, how does the vaccine impact future fertility? I've seen a lot of misinformation about this, especially online. Correct.
Also, the data so far do not support any change in fertility from the vaccination. The governing body on fertility treatment has looked into this and has looked at pregnant women who are trying to conceive and who received the vaccination and those who haven't, and there has not been an increase complication rate related to trying to get pregnant or miscarriages with the vaccination.
Okay, and then finally, is there a shot that doctors are preferring one over the other? And what about the booster shot for those who are qualified right now, maybe the immunocompromised? Is that recommended for pregnant women?
So another good one. So I think at this point, what we're saying in an non-pregnant state is any vaccine is better than no vaccine. In pregnancy, the one that has been most discussed has been the Pfizer one for the FDA approval. However, Moderna is also absolutely able to obtain. In terms of booster, I think that's still up in the air. Patients who've been received their shots more than 8 months ago and are immunocompromised would be candidates for a potential booster shot. I think that's still in the works right now, as well as what we're seeing here is we're trying to figure out the booster shots.
Okay, doctor, thank you so much. I know that this has been a point of conversation with me and my circle of friends, and we certainly appreciate your expertise this morning. Thank you so much for joining us. And I've got her information. So if you have other questions, if you are out there wondering, a specific question, if you're pregnant right now and trying to figure out how best to do this moving forward, please send your emails to me and I'll make sure that we get it answered. All right, back over to you guys.
Happy to help. Bye.
Thank you.